The reason we're doing this series, these two webinars at this point, is because, as I'm sure those of you who are attending have noticed, transgender people are experiencing unprecedented attention here in the United States in lots of areas of life: education, employment, politics, and popular culture. And more transgender people are enrolled in health coverage than ever before as a result of the Affordable Care Act. And we do have federal and state laws and regulations that require health plans to provide medically necessary care for transgender people. And we know that transgender patients continue to face barriers to care and discrimination when they do access care. We know that transgender people delay seeking routine care and even care when they're sick and injured because they're afraid of, they don't want to face the discrimination that happens in too many healthcare settings. So these two webinars are designed to help everyone, the wider delivery system. The CIN audience is mostly primary care folks, to learn more about what it means to be transgender, and also what that means for care experience and the ways to improve care and increase care equity for transgender people in the work that you do. So we're really happy to have you here. And today we're going to focus on, you're going to meet two experts in transgender care and the organizations they represent. Both organizations have a wealth of resources to help with this work. And we're going to focus on transgender identities and the care needs of transgender people. And then in the second webinar, we'll have Jaffe, one of today's experts, will be back, and they will be joined by Dr. Madeline Deutsch, who works with our other speaker today, JoAnne Keatley, who I'll introduce in a second, and is an expert in clinical care. So we'll get more into when people are in care, what do they need in the care setting in terms of the care experience and what the care team should do, and then also some information. This is all very introductory, some introductory information about clinical care. So that's what we have for you, and I'll introduce our two speakers and get out of the way. Our first speaker today is JM Jaffe. JM is the Trans Health Manager at Lyon-Martin Health Services, a primary care clinic in San Francisco that serves women and transgender people regardless of their ability to pay. JM graduated from Wesleyan University, where they studied biology, feminist studies, and pre-med. JM manages Project Health, which they will talk about today, a program of Lyon-Martin which improves access to transgender health with education, advocacy, and leadership. JM also manages the TransLine, an e-consult service that connects providers nationwide to experts in transgender care, and they also participate in local, state, and national advocacy efforts for systemic policy change. JM has worked to ensure insurance coverage of medically necessary care for transgender people and played a major role in advocating for Medi-Cal and commercial insurers to begin covering many different types of gender-affirming surgeries, and to help the state of California enforce the Insurance Gender Non-Discrimination Act that's law in the state. So that's JM. He'll be our first speaker. Our second speaker will be JoAnne Keatley. She is the Director of the Center of Excellence in Transgender Care at UCSF. And JoAnne was born in Mexico City and received a Master's of Social Welfare degree from the University of California, Berkeley. Go Bears. JoAnne and I were in the same social work class. JoAnne is co-principal investigator of the UCSF Capacity Building Technical Assistance Program funded by the Center for Disease Control and Prevention, and the co-principal investigator also of the HRSA-funded Special Projects of National Significance Transgender Evaluation and Technical Assistance Project. At the Center of Excellence, JoAnne and the team there works diligently to enhance transgender care services in California, across the country, and across the world. Working with the Pan American Health Organization, JoAnne co-authored a document called The Blueprint for the Provision of Comprehensive Care to Transgender and Transsexual Persons and Their Communities in Latin America and the Caribbean, which has impacted the quality of care there throughout the region. JoAnne has also directed federally funded research in the areas of HIV prevention and consults on transgender health for such institutions as the World Health Organization, the National Institutes of Health, the CDC, HRSA, SAMHSA, and she's also been an expert at the White House. She has received numerous awards, and including the UCSF Martin Luther King Jr. Chancellor's Award for advancing cultural diversity and social leadership on campus, and was recognized by the state of California for LGBT leadership in 2015. So those are longer introductions than I usually do, but these are two very esteemed speakers with great expertise for us today. So JoAnne, you are up. I am going to transition to your slides. You can begin.
All right, so thank you so much for having me. My name is Jaffe. I'm the Trans Health Manager at Lyon-Martin Health Services, and my preferred pronouns are they and them, gender-neutral pronouns. So today I'm mostly going to be talking about the basics of assigned sex versus gender identity versus gender presentation, a little bit of vocabulary that is commonly used in the transgender community. And I'm also going to be talking about techniques of gender transition that transgender and gender nonconforming people utilize in their lives to be who they are. So just a very basic overview here of what who trans people are. So as Hunter mentioned, Lyon-Martin is where I work. It's a primary care clinic in San Francisco that serves women, lesbians, transgender, and gender nonconforming people, regardless of their ability to pay. And within Lyon-Martin, I also manage a program called Project Health, and Health stands for Harnessing Education, Advocacy, and Leadership in Transgender Health. So our true goal here is to improve access to transgender health throughout the state and nation through education, advocacy, and leadership. And the modules that we've developed to do this are through trainings, whether it be webinars like this or in-person trainings with healthcare facilities. We also have a clinical rotation here at Lyon-Martin where present and future providers can actually shadow our providers at Lyon-Martin and kind of get a grasp of what transgender medicine looks like in the primary care setting. We've also developed a trans line to reach providers that are not physically reachable for us. So we have a electronic online consultation service where providers across the country can email questions about patient-specific cases to experts in transgender care. So that's staffed by providers at Lyon-Martin, at Fenway Health in Boston, at Bay State Health in Springfield, and at Mazzoni Center in Philadelphia. And then we also do policy change work on the local, state, and national level. Lastly, I do manage all of our surgery referrals here at Lyon-Martin and advocate to ensure that our clients are covered with their insurances for these very expensive surgeries. You can click next. All right, so the objectives of today are, as I said, to differentiate between assigned sex, gender identity, gender expression, and sexuality, and also to describe these techniques of gender transition. So just going with the basics here, just some vocab. This is the friendly gender unicorn. And, this slide has been evolving over time to be more and more inclusive, and it's still not yet perfect. So I'll say that with mentioning that there's still improvements to be made to this slide. But the basics of what this slide is trying to get across is that the gender identity is essentially what you feel you are on the inside. And this can be a mix of woman, man, or other genders, that people may feel identified with. It also may be completely disidentified with gender completely, just a gender. And so this is really the internally felt gender. Gender expression is how you actually dress, how you perform your gender on the outside. And these are separate categories. So, you know, sometimes someone may have to express themselves in a certain way in a certain situation in order to be safe. For example, I have a friend who identifies as genderqueer, and when they're with their friends, they dress a certain way. And then when they work in a school as a teacher, they have to prescribe to very strict gender norms. And so they dress as a male in that particular setting in order to protect their own safety primarily, and also to protect their job. So gender identity and gender expression can be completely separate, or they can align. And as I said, similarly with gender identity, it can be a mix of characteristics. Sex assigned at birth is, this is the part that's kind of not completely correct here. So the sex that you're assigned at birth is a designation that the doctor makes as soon as you are born. And that is in a binary fashion, right? It's either male or female. They don't typically assign someone intersex right at birth. So that's my problem with this particular part of the section. But so I'll just use myself as an example here. I'm totally comfortable doing that. So I'm a trans person. I was assigned female at birth. My gender identity is fairly masculine. And my gender expression is a mix of masculine and feminine. So I kind of present as an effeminate male. And then when we come to sexuality and who you're romantically or emotionally attracted to, these are also separate. So for me, I'm attracted to people of all genders. And so I can, as you see here, you can be attracted to any type of gender to a varying degree. And these are all separate categories. And so the real take-home from this slide is that you can't really assume anything about someone's gender identity or their sexuality just by looking at them. It's something that you have to ask about in order to really respect how this person identifies. So the most basic vocab I want to go over here is cisgender and transgender. So this is something a term I'm going to be using throughout the presentation. And if you're working with the trans community, they're going to be using it too. So it's good to really grasp this idea. If any of you have taken organic chemistry, you might remember that there are two formations or orientations of a molecule. The cis formation of the molecule has the R groups on the same side of the molecule, so same. And the transformation has the two R groups on opposite sides of the molecule, trans, so opposite. So a cisgender person is a term that we use for someone who identifies as the gender that is assumed to align with the sex they were assigned at birth. So if someone was assigned female at birth and identifies as a woman, they are a cisgender person. A transgender person, on the other hand, identifies as a gender that is different than the gender that is assumed to align with the sex they are assigned at birth, or as multiple genders, or, as I said earlier, disidentifies with gender completely. So a trans person, I'll use myself again as an example. I was assigned female at birth, and I identify as genderqueer or transmasculine. And many people, just completely disidentify with any gender, and they could also be under the trans umbrella. So getting a little further into this vocab, other words I'll be using today are F to M, which is short for female to male, a trans guy or a trans man. That's essentially what I am. There's also male to female trans people or trans women. There's genderqueer people or gender nonconforming people who kind of lie in between the binary or completely outside of the binary. So these are folks, as I referred to earlier, do not ascribe to the gender binary at all. There are people who identify as two-spirit, and this is specifically a term from Native American culture that people use to talk about how they ascribe to both or neither gender binary categories. And there's infinite other words that if I listed out all of them, we would be here all day long. So I really can't say every single word that people use for themselves because there just are too many. So what we really want people to do is to talk about how they do identify. What are the words that they use for identity? And that's how we respect them. Trans is used as an umbrella term for all of these categories. So I'll often be just talking about trans people, and I'm really referring to all of these types of people. The other thing to take home from this is, from this slide, is that there's also a term called passing. And passing is something that is controversial within the trans community, but it's usually within also a gender binary. So I've been taking testosterone for a very long time. When I'm out in the world, I pass as male. And many people who have not been on hormone therapy for a long time or have not had access to medically necessary surgeries do not necessarily pass as the gender that they identify as. And this can lead to violence in public, and it can also exacerbate gender dysphoria, but not for everyone. Some people like looking in between. Stealth is a vocab word that refers to being someone who's trans but is not out as trans to their community. So if someone passes really well as the gender that they identify as, and they're trans, and no one in their community knows that they're trans, they think that they're a cis person, that is being stealth. Okay, so as I referred to earlier, the gender spectrum, and this is true for cisgender people as well, but for transgender people, there is a spectrum of gender identifications. So just like with the colors blue and red, these are categories of colors, but there's also an infinite number of colors in between those two categories that don't necessarily have names, but we see it as a spectrum of colors. And the same is true for gender identity. So Janet Mock on the left here is a transgender woman who identifies as a woman. And on the right here, we have Aiden Dowling, who's a trans man who identifies as a man. And in between, we have some of my friends who, again, consented to be pictured here, but they identify as genderqueer. And you can't always tell, again, what someone is going to identify as, so it's really important to ask so that we can respect them. And people who are genderqueer often have atypical pronoun preferences as well, which I'll get into in a little bit. Talk a little bit about techniques of gender transition. So just an overview here, and I really do want to get across that transitioning is a lifetime process. We do it every day. There's no beginning or end to the gender transition. There's no one moment where you're like complete. It's just a constant process every day, and everyone's different. So everyone uses a different variation of these things, or maybe other things that aren't listed here, to present as their true gender and feel comfortable in their bodies. So a couple of things that people may use, and again, may not, One is changing their name. The other is changing their pronouns. And these are kind of the most basic things you can do to really express your gender. Changing your name, changing your pronoun, and telling people, coming out to your friends, family, and community about what your preferences are. And, you know, I think shortly after people start changing, or even, you know, again, there's no order to this. People may change how they look before they come out, but they may change their dress, they may change their clothes, their hair, their makeup. They may use different gendered facilities, so bathrooms, dressing rooms, locker rooms. There's also changing identity documents. So you may know that on almost every identity document you have that's government issued, there's your gender marker on there and your given name. And many people try to change their gender markers or their names on various documents to align with their identities. There's also the use of compression or prosthetic devices, and I'll get a little bit into that in a bit. There's also speaking in different vocal pitches, body modifications, tattoos and piercings. Some people feel very strongly that those are tools that they use to present their gender. There's hormone therapy, and there's, of course, surgery. We're getting a little bit into social transition. And again, this is non-medical versions of transition. So this is me. This is my old ID with my new ID. And changing identity documents can be a really powerful way to socially transition, because it's something that you show to almost every person, whether it's using your credit card to show that you are that person, getting into a bar. Almost every situation, going to the airport, requires you showing your ID. And if someone sees your ID and you look drastically different from that picture, or you don't look like the gender that's listed there, it can be an issue. It can draw attention to you. It can be a violence issue, opportunity for harassment. So changing documents can be a really important way to socially transition. So using different bathrooms, again, similar situation. These are, you know, publicly gendered facilities that can leave people very vulnerable to harassment and violence. When I was first starting to take testosterone, I had a very hard time with this because I was constantly debating, should I go into the women's bathroom and get yelled at for being there? Should I go into the men's and risk getting beat up? There was really no good answer. And so having gender-neutral bathrooms is a really important way to help trans people survive in public spaces. So I talked a little bit about compression and prosthetic devices. I'm going to talk specifically a little bit about the different tools that people can use without medical interventions to express their gender and alter their bodies. A binder is a chest compression device. It's much like a bra, but it's a little thicker and makes your chest look flat. A packer is essentially a prosthetic penis to be used in the underwear to kind of create a bulge. There's also stand-to-pee devices, which people can use to actually stand to pee in male restrooms to feel like they are more comfortable there. And there's also dildos or strap-ons to be used during sex. And then for trans women, similarly, there's breast forms. There are silicone implants just to be placed within the bra. There's gaffs, which are compression underwear that facilitate tucking the penis. And there's padded bras and underwear that allow you to have more of an hourglass-like shape. All right, so next we're going to get more into medical transition, and here we're going to talk a little bit about hormone therapy and surgery options. So the idea behind hormone therapy is that, you know, if we introduce exogenous hormones, it's actually going to suppress the release of the endogenous hormones. So when we think about how hormones are released in our body, there's a gonadotropin-releasing hormone that is released at the level of the hypothalamus that then acts on the pituitary to release luteinizing hormone, follicle-stimulating hormone, which then act on the gonads, whether it be the testes or the ovaries, to stimulate the release of either testosterone or estrogen, respectively. So when we introduce exogenous hormones, it has a negative feedback loop on this cycle. So for trans men, we use testosterone, and this actually is overpowering the endogenous estrogen in the body. And then for trans women, we use estrogen, but we also have to use a testosterone blocker called spironolactone to actually see the effects of estrogen working on the body. Sometimes we also prescribe progesterone to especially increase breast growth. There's also something called Lupron, which can be used for trans youth that actually inhibits the GnRH cycle during puberty. And so you can essentially arrest puberty during development, secondary sex development. And the purpose of this really is to allow trans youth to decide, do I really want to go through this puberty? You can do the Lupron with other hormones like testosterone or estrogen to go through a completely different puberty, or you can just arrest the puberty, and then if they decide, no, I think I'm good, I'm just going to go through my my regular puberty that I would have gone through anyway, they can just stop taking it, and it would their body would pick up where it left off. Okay, so I'm going to go over surgical options currently available for trans people. For trans men, there's a mastectomy, which is by far the most common surgery sought after by trans men. It's the removal of the breast tissue. There's also hysterectomy, the removal of the uterus, which if some people either aren't on testosterone and are still having periods that are causing them dysphoria, can be really helpful surgery. There's also oophorectomy to rid the body of the ovaries, and that, of course, will also rid the body of any estrogen. There's vaginectomy, which is the removal of the vaginal tissues and the closure of the vagina. Metoidioplasty is the severing of a ligament that holds down the clitoris. So your clitoris then actually hangs a little bit more forward. You can get usually about a 2-inch clitoris from metoidioplasty. And this can happen with also a urethral lengthening so that you actually can urinate through your clitoris. Scrotoplasty is a creation of a scrotum with the labial tissue, and you can have testicular implants placed into the labial tissue to create scrotum with testicles. And you can do that with metoidioplasty as well. So the most complex metoidioplasty is with the urethral lengthening, the scrotoplasty, and the testicular implants. And then there's phalloplasty, which is the creation of a neophallus with graft tissue from either the forearm or the thigh. And they do use a penile implant. There's 2 different types that you can use. One is a semi-rigid rod, and the other is a saline pump to actually achieve erection with the phalloplasty. There's also facial masculinization surgery, which is a variety of different surgeries together to masculinize the bones of the face. And there's body contouring, which is essentially liposuction of the hips, the thighs, the butt, anything that's making the body look more feminine than the client would like. Lastly, going over the feminizing surgery options for trans women, there's breast augmentation, breast implants, which are either silicone or saline. There's orchiectomy, which is the removal of the testicles through one simple incision in the scrotum. There's penectomy, which is a relatively rare surgery, but some people do get it, which is the removal of the penis, and the urethra is then placed between the anus and the front of the body. There's the vulvoplasty, which is the creation of a vulva, but not the internal vagina, so just the outside of the vulva. And then vaginoplasty is vulvoplasty with the actual creation of a vagina. Usually this is done through a penile inversion technique in the US, but there are other techniques also utilized in other countries. There's facial feminization surgery, which, similar to the masculinization surgeries, is a variety of different surgeries together to feminize the face. There's tracheal shave, which is the shaving down of the Adam's apple. And then facial electrolysis can be especially important for trans women and bodily electrolysis generally. And part of the reason for this is that testosterone treatment for trans men creates hair follicles. But estrogen and spironolactone for trans women doesn't actually rid the body of hair follicles. So no matter how much hormone therapy you're on as a trans woman, you will always have these hair follicles unless you get electrolysis. And that's just a limitation of the biology. So this can be an especially important thing. Lastly, there's body contouring to accentuate the hips, the thighs, and the butt as needed for the client. So that's it for my section. Thank you so much for listening. I'll hand it over to JoAnne.
Great, thank you, JoAnne. And please do feel free to chat in questions at any point. As I pull this up, we are going to go straight into JoAnne's section in the interest of time, but if you have questions about what JoAnne covered, they were able to fit in a lot of really important information in a very short time, so thank you, JoAnne, for that. And but now we're going to turn to JoAnne, and then again we'll have time for questions at the end, so please put things in chat as they come up for you. JoAnne, are you there?
Hello, this is JoAnne.
Hey, JoAnne, go ahead.
Great, thank you. Sorry about that. I had my phone on mute, so I had to unmute myself. Anyway, hi, my name is JoAnne Keatley, and I'm the director of the Center of Excellence for Transgender Health. I did want to just thank JM for the excellent overview that he just gave, that they just gave. So without further ado, I'll get started here. Can we go to the next slide, please? So our mission at the Center of Excellence is to increase access to comprehensive, effective, and affirming healthcare services for trans and gender variant communities. And increasingly, we're doing that in a global environment. The picture that you see in front of you represents our National Advisory Board of trans community members. And, you can see it represents kind of a richness in diversity and representation. Next slide, please. The Center of Excellence, or I'll just abbreviate the COE, at UCSF has been in existence since 2007, although I've been at UCSF since 1999, engaging in conducting some formative research prior to the existence of the Center of Excellence, all focused on trans populations. We build on the strengths of two well-known training and education centers and research centers. The Pacific AIDS Education and Training Center, which is funded by HRSA, the Health Resources and Services Administration, and the Center for AIDS Prevention Studies, which has a variety of funding sources, but is part of the AIDS Research Institute, the largest AIDS service or AIDS research entity in the world, actually. I wanted to share with you a little bit about what trans people face in terms of discrimination in healthcare settings, and also this is a good way to kind of review some of the social determinants of health that drive the health outcomes for trans populations. So this is in reference to a report that was published in 2011 by our colleagues at the National Center for Transgender Equality and the Gay and Lesbian Task Force, both of which are housed in Washington, D.C. They published a report called Injustice at Every Turn, a report of the National Transgender Discrimination Survey. This report is actually a very powerful tool for trans people and their allies who are increasing access to comprehensive services for trans people throughout the U.S. When it was published in 2011, had been the largest survey of trans people to date. So 6,450 respondents representing a diverse set of people from all 50 states, the District of Columbia, Puerto Rico, Guam, and the U.S. Virgin Islands had completed online or paper surveys. And just as an aside, this survey has recently been re-implemented, and I've heard from the National Center for Transgender Equality that this version, this updated version, has at least 28,000 respondents. So we hope to get a lot more meaningful findings. Next slide, please. One of the key findings from the survey was that respondents often encountered ignorance about basic aspects of transgender health and found themselves required to teach their own provider in order to obtain appropriate health care. Fully 50% of study respondents reported having to teach their providers about some aspect of their health care needs. And from the Center of Excellence perspective, we feel that this is not an appropriate role that patients should be taking when they're seeking health care. It's fine to be, obviously be informed and be, an active member of their care team, but they should not be responsible for teaching their providers on how to provide appropriate care. That is a function of the provider. Next slide, please. And so when we look at what were some of the barriers to care, the findings from the discrimination survey reported on anti-transgender bias in healthcare settings, disrespect, outright refusal of care, verbal harassment in healthcare settings, physical and sexual abuse. Participants responded and reported such behavior. And then trans people of color and low-income respondents faced elevated risk of poor health outcomes than the sample as a whole. Next slide, please. More barriers to care. So refusal of health care. So 19% of the study sample were refused care specifically due to their gender identity. They also reported high HIV rates, over 4 times the national average, with higher rates among trans women of color. And then 28% reported delaying their care due to fear of discrimination in healthcare settings. And 48% responded that they had postponed any kind of care because they could not afford to access care. I think that JoAnne mentioned some of the work that they've been involved in terms of California and California's implementation of non-discrimination language for healthcare access in the state. But certainly throughout the U.S., there are many places where trans people have to pay for their care and are often forced to make decisions about whether they'll be able to pay their rent or eat or access care. Next slide, please. Also, the survey found high rates of discrimination in public accommodations. Over half of the respondents, 53%, reported being verbally harassed or disrespected in a place of public accommodation, including hotels, restaurants, buses, airports, and governmental agencies. And actually, we've been, over the last year, as I'm sure many of you have seen reported in the media, there has been an increase in the bullying and targeting of trans populations as there has been increased awareness of the existence of the trans community. And we've seen a backlash in terms of state and local laws that are meant to limit access to public accommodations for trans populations. An example is the HB 2 law that was passed in North Carolina and access to bathrooms. So another finding was 1/5 or 22% were denied equal treatment by a government agency or official, and 1/4 or 25% reported being harassed or disrespected in a doctor's office or hospital. Next slide, please. There are many anti-discrimination laws. There are also, a lack of those laws. Less than 100 jurisdictions explicitly protect people based on gender identity and expression. 37% of Americans actually live in an area which bans discrimination based on gender identity or expression, which conversely means 63% of Americans live in an area where discrimination based on gender identity or expression is not specifically outlawed. Next slide, please. So these are just some examples of good practices based on a two-step data collection method that we've pioneered at DOE and has now been adopted by many of our federal partners, including at HRSA and at the CDC, and was integrated into other approaches internationally. So we recommend the collection of gender identity as a first step in the process. So what is your gender or gender identity, with drop-down menu options of male, female, transgender male or trans man, transgender female or trans woman, gender queer, other. Please specify. The menu options are really not the important part of this question. The important part of this question is, what is your gender or gender identity? And then, the menu options can be tailored to the region in which the question is being asked. But the important thing is to ask the first question and then follow up with the next question. Next slide, please. And so the next question is, what sex were you assigned at birth? And those two pieces of information, asking about a person's gender identity and then also asking about the sex assignment at birth with options of male, female, and decline to state, will really be able to tell you if the person that is in front of you is a trans person, or at minimum, if you should ask additional questions in order to clarify if this is a trans person, and then what are the care needs of the person that is in front of you. Next slide, please. I think another important consideration is to ask your patient, what pronouns do you prefer, and then document filling in the blank. So whatever they may be, for if they are male identified or female identified or non-binary identified, there are options that you can use and affirming language that you can use in order to honor and respect the person's gender identity. Next slide, please. And then certainly for physical exam, it's important to assess for immediate health needs and not necessarily for, really engaging in sensitive exams until they are absolutely necessary. It's important to treat the presenting issue and assess the health of the organs and body parts that are present. Always respect the patient's stated gender. And again, delay sensitive exams until they are necessary and part of the care plan. Next slide, please. Electronic medical records also create some challenges. There are many, EMR vendors, electronic health records vendors, and each one comes with their own process for collecting sex assignments and or gender. There are some modifications that can take place in order to capture gender identity fields, but we don't have a standardized approach, unfortunately, and so this is a challenge for trans people in healthcare settings. Often electronic medical records lead to inappropriate questions being asked of the patient, and also many opportunities for a violation of their confidentiality if a trans patient is in a waiting room and medical staff are referring to them in their legal name or the name that is based on their electronic medical records that may not correspond with their experience as a trans person. So just lots of problems with current utilization of electronic medical records. Next slide, please. And then, of course, navigating insurance problems. Many procedures that are coded for sex-specific processes, and then treatments that are frequently denied for trans patients. Physicians can really play a role in eliminating stigma around these issues. And I know that in the next webinar in this series, that Dr. Deutsch will be able to really go into much more depth around the role of a physician in eliminating this stigma. Next slide, please. Sex-segregated systems really create much problems for trans people. Restrooms, and as I just mentioned the case in North Carolina, but North Carolina is not the only place where those kinds of things are happening. Even in our own, institution and throughout the state of California, there are many buildings that don't have single-stall bathrooms or gender-neutral bathrooms where trans people can use the facilities and, eliminate their bowels or bladder in these public restrooms, and they create lots of issues for us. So we must do a better job of identifying those single-stall bathrooms and really making them accessible for, not just for trans people, but for anyone who might need access to a bathroom that's not based in the binary. So here are some good treatment practices. Use proper pronouns with all clients. Get clinical supervision if you have issues or feelings about working with trans individuals. Don't, don't work out your own stuff with your trans clients. Do accommodate trans clients' desire and need to continue the use of hormones. And facilitate trans clients using street hormones to obtain competent medical care and getting them off of underground hormones and getting them into actually competent, affirming medical care. Next slide. Develop a bathroom policy that's based on gender self-identities and gender roles in all public accommodations. Create and maintain a safe environment for all your trans clients. Next button, please. Develop and post non-discrimination policy that explicitly includes gender identity. Provide and encourage training on trans healthcare issues. Next slide. This is just an example of one of the resources that we have on our website at the Center of Excellence for Transgender Health. It's transhealth.ucsf.edu, and this is a virtual training course that we have that's about 20 minutes long. It's called Acknowledging Gender and Sex. It's really kind of a fun way to have an overview of how to create a welcoming environment. And we use avatars and audio and written material in the course. It only takes about 20 minutes, but I think if you go through this course, you'll hear and read a lot of the best practices for engaging with trans populations in a healthcare setting. Next slide, please. And I will close with a quote from Martin Luther King Jr. that of all the forms of inequality, injustice in healthcare is the most shocking and inhumane. I would agree with that quote. I think of it often, and I want to thank you for being part of the solution. Thank you.
Great, thank you, JoAnne, and thank you, JM. So we have a few minutes left. Like JoAnne covered a lot of ground in a short amount of time. We do have our second session that we hope all of you will join us for coming up in a little over 2 weeks. But if anyone has questions now based on what they presented, please chat those in, and then we will wrap up by directing you to the other resources. Some of the resources that are available both at Lyon-Martin and at the Center of Excellence. You see the website here as a way for you to dig in, help increase your knowledge, and hopefully help other people you work with increase their knowledge so that they can feel ready, informed, and fully able and happy about providing better care to trans people versus hesitant and unsure. So any questions, please chat those in, and Canel or I will, or both of us will see those.
Hunter, one just popped into the questions box.
Great. Will you read it? Will you read it off? It's not showing on my screen here.
Sure. Hold on. Let me pop it open. So the first question is there any way for oh, I'm sorry. Actually, most of these are just technical questions, but we did get a comment that this has been very helpful, and that it was really informative to see all of the challenges, and they thank you very much for your presentation.
Great, I agree. I have a question. Do either of you know, JM or JoAnne, about this the EHR, EMR situation? Because when we do quality improvement work, we always try to make the right thing to do the easy thing to do, and certainly having fields for more than male and female gender would be one thing that I think you were alluding to, JoAnne. So do either of you know of vendors that are working on that, or is there an organized campaign to help some of the bigger EHR vendors make their software products more trans-friendly?
Well, you know, what I would suggest is looking for an article that we authored. Maddie Deutsch was the lead author on it, but, you know, other members of the team from the COE contributed, including myself. But it was published in the American Journal of Informatics on EMR utilization. So if you look for that article, you can find it on our website, but you can also do a search for it on the journal itself. So trans people and EMRs.
Great, thank you, JoAnne, for that resource.
I also know that because the CDC just released requirements that health centers document sexual orientation and gender identity data, that the feds are also working with the different EHR vendors to ensure that that data is collectible. Even at Lyon-Martin, we are using workarounds currently to ensure that the appropriate names and pronouns are documented and that everyone knows where to look in order to respect the person. So I think that this is something that on the federal level, you know, it's really great that they are actually trying to work with the EHR companies to make all of them equally as competent. Because right now, I agree, it's a mess. It's really hard to figure out. And I think additionally, you know, something to consider is what information is really needed here. Like what information is really needed both to build a patient and to respect the patient, and where does that need to go just to get the job done. And I think working with your billers and working with the medical teams together to figure out, you know, where do we look for these certain things, where does it need to be, where is it optional that that needs to be that particular name, is crucial to the process.
Great, thank you both for that response.
Hi. Two more questions just came in, one from Edward Davila and one from Natalie G. The first question is, what is the percentage of clients who cannot afford the treatment for transgender change?
We don't have clear data on that because of the lack of gender identity variables to date. This is not these are not questions that are being asked of us. And so, you know, I think any number that we would toss out would be conjecture. It's not something that we have a clear sense of.
That's great.
Okay, good question. No real answer at this point. Can we do the other question real fast, Cal?
The second question is, JM mentioned that passing is controversial. Are they referring to the use of the term or the concept in general?
So the use of the term is controversial, and just the concept is also controversial, just because, you know, passing is, you know, a lot of people have the desire to pass, but I think that, you know, instituting a hierarchy where those who are passable are better trans people or are like doing it better than other trans people is where the controversy lies. And you know, I don't think anyone wants to create a hierarchy of being a successful trans person or being successful at your gender. And so I think a lot of people use passing as the measurement of success when it comes to gender transition. And that is the problematic thing, because not everyone has access to the things that they need to pass. Not everyone wants to pass. So that's the controversy.
Right. I think what you said, JM, resonated with me is that it's not everybody's goal to reach one end of the gender continuum or the other. People are happy and are satisfied in who they are, where they want to be seen is somewhere in the middle.
Right.
You know, I would agree with you both. I think that not everyone is interested in passing. I think that also there's a problem with, you know, just the fact that many people, you know, will never be able to pass regardless of what pressures they feel from society in order to kind of conform to their standards of, you know, gender presentation. So I think it's not only a problem in the way that it's perceived, but also in being able to achieve. And so I think it's a problem, you know, for us all around. I also think that those that are able to, you know, quote unquote pass, do have greater access to certain privileges such as employment and, you know, access to housing, access to safety, things like that. So there are a lot of pressures on trans people to, you know, kind of conform to society's norms if they're able to do so. It's, you know, it's really a complicated issue.
Yeah, thank you, JoAnne. Yes, exactly. You covered it well. So we're at our time, so we do want to let you go, but just quickly, so again, thank you to our two speakers. You guys were both amazing. We'll have JM back for the second session, along with Dr. Madeline Deutsch, who JoAnne mentioned as a colleague of hers, is a provider to many trans people at UCSF. You will receive a survey from us, a three-question link, a link to a three-question survey about today's webinar, including future topics for CIN webinars. Please fill that out. Also, there will be a recording of this webinar posted. We do have a lot of people, hundreds of people, experience these webinars in the canned version. That recording will be posted in about a week. For anyone else who want to refer to that, who could benefit from it, we'd appreciate your help with that. And again, we hope to hear from you, have you on the session with us, the second session on May 23rd. So thank you all very much. Have a great afternoon.
Thank you, Hunter.
Thank you.
Thanks, everyone. Bye.